Gentlemen, if your penis feels numb, less sensitive, or switched off, especially along the top or the sides of the penis, that can feel terrifying. It's natural for most men to think, I've damaged a nerve, or this is permanent. In many cases, the nerve involved is called the dorsal nerve of the penis, a branch of the pudendal nerve. Today, I'll explain what this nerve does, how pelvic floor tension can irritate it, and why stress and anxiety can change your penile sensation. And most importantly, we'll go over an action plan that you can implement today for your recovery. Keep in mind that this video is for educational purposes only, and it's not personalized medical advice. Always follow up with your family doctor. Quick anatomy lesson. The pudendal nerve is the main nerve for the perineum, and it supplies the sensory and motor supply of the penis, the scrotum, and the anus. One of the branches, the dorsal nerve of the penis, runs under the pubic bone and along the top of the penis and into the glands. Think of that nerve like a cable branch feeding sensory information into the brain. If that nerve becomes irritated, not necessarily damaged, you may feel reduced sensitivity, tingling, altered orgasm, or some strange disconnect that you can't really describe. The good news is that permanent nerve damage is uncommon without any major trauma or surgery. Research shows that the pudendal nerve can be irritated by mechanical compression. This can be constant long bike rides, which there's some interesting research that shows temporary decreases in penile vibratory sensation after long rides, indicating compression at that pudendal nerve. If you're a cyclist and you've noticed some changes in pressure or penile sensitivity, you might want to see a physiotherapist in person for an in-person bike fit or to change the saddle to something more comfortable. But this can also be a prolonged sitting problem. When we sit on a hard surface with slumped posture, and in particular the pelvis is tucked under, pressure shifts forwards onto the perineum, exactly where that pudendal nerve runs. This is direct perineal trauma, and this can lead to hypertonicity or guarding at that pelvic floor. Some men I see in the clinic experience pudendal nerve tension after traumatic groin injury, and over time that tension builds around that pelvic floor, which leads us into the concept of pelvic floor overactivity. The pudendal nerve travels through tight anatomical spaces near that pelvic floor. If those muscles are chronically tense from stress, guarding, or anxiety, they can increase local pressure, reduce the ability for the nerve to move well or glide into its spaces, and create a sensitized environment. This is nerve irritation, not necessarily entrapment or permanent damage. And good news, irritated nerves can calm down. This is where it gets really important. Penile numbness is not only a wire problem, but it's also a brain processing problem. Here's what the research tells us. Many men with genital sensory complaints have normal nerve conduction tests, and the chronic pelvic pain research shows that central nervous system modulation can alter the sensations that we experience without structural damage. Anxiety then increases that threat detection in the nervous system. When the brain perceives the threat, especially around sex or performance, it can damp down that penile sensation, distort the body mapping, and increase hypervigilance. And here's the trap. The more you check the sensation, the more the nervous system goes into that monitoring mode instead of that natural arousal mode. Psychosomatic does not mean imaginary. It means that the brain and the body are interacting in a suboptimal way. The key takeaway is that you can absolutely have mild dorsal nerve irritation plus anxiety-driven sensory modulation, and that combination is incredibly common. Keep in mind that you want to see a doctor urgently if there's numbness spreading to the inner thighs or the anus, a new leg weakness or a loss of motor function, loss of bladder or bowel control, or some severe new back pain. Otherwise, most cases fall in an unexplained chronic pelvic pain pattern. On a side note, if you have experienced penile numbness and you've noticed a sense of fullness in the penis while it's flaccid, check out this video I made on my channel to learn more about a condition known as hard flaccid syndrome, as it might be more of what you're experiencing. When it comes to physiotherapy treatment for this, it usually involves 3 things that you can do today. Step 1. Reduce the irritation at your pelvic floor. Pelvic floor stretching requires attention at both the brain and the body. When you're doing this, you need to feel a subtle lengthening at the muscles between your sit bones. It's definitely not something you can force, and you need to stay relaxed and intentional. One simple drill is to work on diaphragmatic breathing, where as you take a deep inhale breath, you want to feel the pelvic floor gently descend and drop. If you can get the feeling of that pelvic floor descending, then we want to try to move and incorporate a stretch into this. Step 2, Calm the nervous system. Box breathing is a quick 5-minute breathing tutorial that I get my clients to do to calm their nervous system. It's a practice where you breathe in for 4 seconds, hold for 4 seconds, breathe out for 4 seconds, and hold for another 4 before starting your next breath cycle. Step 3. Retrain the brain interpretation. This is especially useful if you've been fixated on your penile numbness and are constantly stressed or anxious about it. A simple starting exercise, using cotton swabs or your finger, gently explore light touch to the thigh, the groin, and then the penis. With curiosity, not testing. Notice what is present, not just what feels missing. This intentional practice is called tactile discrimination training, a type of sensory motor remapping. If the anxiety is high or that checking becomes impulsive, also working with a sex therapist or a psychologist can be extremely helpful. And so that's it. Penile numbness does not automatically mean permanent nerve damage. In many men, it's a mix of nerve irritation, pelvic floor tension, and stress-driven nervous system modulation. And these patterns are highly treatable. If you learned something from this video, please hit that like and subscribe button. It really does help with getting this video out to more men, and these men can likely benefit from this information. Thanks for watching.